Thank you, Congressman. Great pleasure to be here. Thank you for putting on this event. I have been tasked with talking a little bit about how the health care bill the Congressman was talking about will affect small business, because that has not been discussed nearly enough out there. And let me start by saying, if you're interested in small business, you should be concerned, very concerned about what they're doing in the legislation. I spend a lot of time working on health care issues, and I can tell you, working with members of Congress and their staff, the vast majority of them know absolutely nothing about the health care system. That has never stopped them from trying to reform it, but they don't know much about it. We are blessed in the fact that Congressman Burgess absolutely knows this system well. When you hear the question and answer later on, you can't make this stuff up. He can handle himself. He knows the system well. But just to give you an example, back in 1993, when the Clinton health care debate was going on, health care reform was all the rage in Washington. I got a call from a senator's aide at the time. The senator had tasked the aide with writing a comprehensive reform of the health care system. So he called me and said, "Do you mind if I ask you a question?" I said, "Go right ahead." "Well, the boss wants me to write this comprehensive reform on health care. Could you tell me what a deductible is?" True story. The man who was going to reform the U.S. healthcare system, as soon as he could figure out what a deductible is. And that kind of mentality goes on in Washington, in the fact that many times they simply don't know what they're doing, as they want to jump right in and reform it. So we've got a task ahead. There's a lot of discussion about the tax increases that are going on. The Dallas Morning News had a piece here on July 31st where it lists the various bills. And right here, under how it's paid for, it lists various types of tax increases that would be being considered as a way to pay for the health care legislation. I notice in here it says nothing about small business. You actually have to get down here to requirements for employers to find out about the new tax on employers. They're not calling it a tax, even though it is a tax. If there's one thing they have an agreement on in these various bills, it is that there will be an employer mandate. That is, employers will be required to pay for health insurance, or you will have to pay a penalty. There's also an individual mandate requiring individuals to have it, but the employer mandate is something that is not discussed that much. So you will be looking, if the legislation passes, there will be an employer mandate out there requiring you to provide health insurance. How does it work? Under the legislation that we're talking about, the House bill, there's sort of three basic thresholds here. Do you have more or fewer than 50 employees? Because it will affect how you're affected under this. Is your payroll less than $250,000 a year or more? And are you currently offering health insurance, or do you plan to offer health insurance or not? Companies with 50 or more employees will have to provide health insurance or pay a payroll tax, or tax of 8% of their payroll. So if you don't provide the health insurance, you've got to pay 8%. If you are fewer than 50, if you have payroll between $250,000 and $400,000, you will pay between 2 and 8%. It'd be a sliding scale. But over $400,000, you'll be paying the 8%. Companies with less than 50 employees, fewer than 50 employees, some of the rules still apply, some change. You may get tax credits out there if you're a smaller employer, to help you pay for it. If you're a larger employer, you don't get those tax credits. It appears that maybe some of the smallest businesses may be exempt. We're not entirely sure. That doesn't exempt the individual from having to have insurance, but if you have 2 or 3 employees, you may not be required to do it under this legislation. So what's happening under the current offering? Because Congress is mandating the insurance, then Congress will have to tell you what the insurance looks like. Because if you're required to do it, then you've got to come back and say, you got to tell me what's going to be in the package, so I know whether or not I'm breaking the law. So Congress will have to craft what the benefits look like. When that happens, everybody with some kind of interest, something they want covered or something they'd like to have paid for, will descend upon Washington to make sure everything is covered. They can do that in the legislation. They can do that after the legislation. That means there will be a lot of pressure on the plan to be a very comprehensive, what we call rich benefits plan. Now, it's nice if you have health insurance that covers everything, but it becomes very expensive. There will be a lot of pressure on it to do that. The other thing is, after employers say, tell us what that health insurance looks like, because we got to know whether or not we're breaking the law, is if you're going to make us do it, you got to make sure it's affordable for us. So there will be both upward pressure to cover everything and downward pressure to keep the prices affordable so people can afford it and employers can afford it. That creates this sort of tension here that never really works very well. Because once they get this passed, they're going to find the spending exploding. When that happens, they're not going to say, well, maybe we messed up in passing this legislation. Maybe we included too much. It must be the greedy doctors, the greedy hospitals, the greedy employers, or the greedy insurers out there that are doing this, and we're going to have to step in there and impose price controls on it in order to make sure that it's affordable. In addition, the pressure on keeping those comprehensive benefits in there means that some things will probably be excluded. This particular Congress does not like a lot of the products that are offered out there in the health insurance marketplace, like health savings accounts, health reimbursement arrangements, high deductible plans, limited benefit plans, a lot of those that we call the consumer-driven health care plans. This Congress thinks that's junk insurance. They would much rather you have very comprehensive coverage with a relatively low deductible. So if you're a business and you've been moving to these HSAs, HRAs, and things like that, and many businesses are, because that's the only place you're really bending the cost curve out there, is the only thing that's actually controlling healthcare spending, you're likely to find that there will be some challenges in keeping it, either through the front door, where they directly stop it, or through the back door, where they impose so many restrictions or qualifications on it that you as an employer feel like you can't do that anymore. So a number of the policies that are out there that are actually helping to control healthcare spending and are allowing smaller businesses to offer health insurance because they're more affordable, there will be some pressure to not even have those out there and available to you. Now, what does this mean with the healthcare system? Hawaii passed an employer mandate back in 1974. But when you pass something like this, then you have to qualify what is it going to be, who has to do this. Well, in Hawaii, they said we're going to say that if you work more than 20 hours, you're considered full-time, and the employer has to provide health insurance. If you work less than 20 hours, then you don't have to. Guess what happened to Hawaii's economy? You created a part-time economy, because many employers simply will let people work up to 18, 19 hours, and then that's all you get to work, because other than that, I've got to provide health insurance for you. I've been to Hawaii twice, both of them conferences. I was at a hotel and was asking the lady who was checking me in. I said, now, have you been working? No, I only work 2 or 3 days a week here. Really? Why is that? Well, because I only work 20 hours. And so I've got 2 other jobs that she used to make up the difference. A part-time economy. Did they solve their uninsured problem in Hawaii? The percentage of uninsured in Hawaii is about 9 to 10%. That's less than the national average, but there are actually a number of states that don't have an employer mandate that actually have a lower percentage of uninsured. Secondly, the state of Massachusetts passed legislation 3 years ago that imposed an employer mandate and an individual mandate. What's happening there? Well, once they came in and said, here's what the benefits package has to look like, there were several 100,000 employees who had coverage that didn't meet the qualified standard. And so they were not qualified under the law. The employers were either going to have to bump up those policies, or else they were going to have to pay the penalty. So you will have that. If they pass the standard out there, you'll find a number of employers who provide coverage right now simply will not be qualified under that. They may be passing the biggest corporate tax increase in history. The U.S. has the second highest corporate tax in the world. The Tax Foundation says when you take our corporate tax and you add it to the average state tax, about 39.1% is what the corporate income tax is in the U.S. 39.1%. But that's on profits. The payroll tax is on your payroll. if you're looking at an 8% tax on payroll, and you have a heavy percentage of your expenses, your company, is in labor, you may find the payroll tax could actually exceed what your corporate income tax is. Could be the largest corporate tax increase we have in history. And finally, it is making things harder for small businesses. If you put this on small business, they end up having to raise their prices if they can continue with the employees and so forth, and if they're able to do it. They end up raising the prices on their products or services, making them less competitive with other companies overseas, making it harder for them to compete. That is not the way you want to go. So we agree that it was good to be able to give health insurance to employees, but we think the way to do that is to create a pro-growth economy where the economy is bringing in plenty of money, making your profits better, and making it easier for you to be able to afford the health insurance policies. We do not think that imposing legislation like this with this huge new tax increase is the right way to go. It will simply hurt business. Thank you.